I always ask patients to describe the sensation in their own words and to tap it out on the table the way their heart feels. That can be surprisingly helpful to distinguish regular from irregular rhythms. Then we usually do an ECG to record the heart's rhythm. The challenge is that palpitations can come and go, so a single ECG might be normal. That's where Holter monitoring comes in. A Holter monitor records your heart rhythm continuously over 24 hours, 48 hours, or sometimes longer. If the palpitations are less frequent, we can use event monitors or even implantable loop recorders that sit under the skin and track the rhythm for months. Blood tests can also be useful to check thyroid function, since an overactive thyroid can cause palpitations. Echocardiography and ultrasound scan of the heart may be done if we suspect an underlying structural problem. When we connect the dots, the patient's description, ECG, or Holter findings, and any underlying medical issues, we can usually explain the palpitations and decide whether treatment is needed. Treatment depends entirely on the cause. If palpitations are due to benign ectopic beats, often reassurance is enough, along with advice on reducing triggers like caffeine, alcohol, and stress. If it's atrial fibrillation, we may need medication to control the rate or rhythm, and sometimes blood thinners to reduce stroke risk. For supraventricular tachycardia, beta blockers can sometimes help. Otherwise, catheter ablation can offer a cure by targeting the abnormal electrical pathway. In rare but serious ventricular arrhythmias, implantable defibrillators may be needed. So when should you worry about palpitations? Red flags include palpitations accompanied by fainting, severe chest pain, breathlessness, or dizziness. Also, if you have a history of heart disease, or if the palpitations are very frequent and disruptive, it's worth seeking medical advice. On the other hand, if you only notice an occasional flutter after too much coffee, it's usually nothing to worry about.